What is amenorrhea? Absence of menstruation. What are the symptoms of amphetamine abuse? Nervousness, restlessness, excitability, diaphoresis. What are the signs of acute glomerulonephritis? Periorbital edema, decreased urination, anorexia, hypertension. What are the signs and symptoms of hypokalemia in a child? Weak pulse, hypotension, muscular weakness, diminished reflexes, loss of peristalsis, cardiac arrest. Why is aspirin given instead of Tylenol in a child with rheumatic fever? It controls fever and relieves joint inflammation. What type of insulin is given intravenously? Regular insulin. When should we administer a child's dose of regular insulin? 30 minutes before a meal. What are the signs that indicate that the child is having a hypoglycemic reaction to insulin? Shakiness, sweating, tremors, weakness, hunger. Why is insulin given subcutaneously and not by mouth? Because digestive enzymes would destroy the insulin. Why should insulin injection sites be rotated? To prevent lipodystrophy of subcutaneous tissues. What is a full thickness burn? It involves total destruction of the epidermis and usually the dermis and underlying tissue. It's painless and edema may be present. What is the most appropriate action in preparing the hospital room for a child admitted with diagnosis of tonic-clonic seizures? Pad the side rails on the bed to protect the child from injury. What route of temperature assessment is contraindicated in a child with leukemia? Rectal. What are the indicators of blood transfusion reaction in a child? Feeling cold and having chills, fever, rapid pulse rate, itching, hives, lower back pain. What is the best way to perform otoscopic examination to be able to properly visualize the auditory canal? For a child greater than 3 years of age, pinna is pulled up and back. For a child less than 3 years old, pinna should be pulled down and back. What is the age to perform corrective surgery for a newborn with hypospadias? Between 3 and 4 years of age. What are the classic signs of increased intracranial pressure in a child? Change in level of consciousness, rise in blood pressure, increase in body temperature, decrease in pulse rate, widening pulse pressure. What do we mean by stroke volume? The amount of blood ejected by the heart in one contraction. What do we mean by preload? The amount of blood returning to the heart. What do we mean by afterload? The resistance the left ventricle pumps against when ejecting blood. What is the earliest sign of shock in children? Tachycardia, pale, cool, mottled skin, delayed cap refill.